cholesterol lowering and statins for prophylaxis of vascular events are dangerous and not helpful.
Thanks so much, Mr. Chairman. Thanks, Franks, to do the hallmark of the VC meeting, the statin debate. I hope I'm going to show something that will impress everybody. I didn't employ any of the 39,000 published articles that any of the authors have acknowledged receiving funding or research application grants from any pharmaceutical industry and employee of the following. And you read all the names. We are observing the revealing of the utmost medical tragedy of all times. Never before in history had the medical institutions deliberately produced a life-threatening nutrient deficiency in millions of otherwise healthy people. Any negative studies on statin are discouraged and critical researchers are blackmailed.
As physicians, we're not very good at saying we don't know at times. It's fine for you to shout about the benefits or overstate the benefits of a treatment. The minute you raise concerns that something might not be working as well as it should, you are often criticised, you're told you're unnecessarily scaring the patient.
Moreover, we have seen there is no benefit in any patient older than 75 years of age. Promotion of statin treatment by statement for primary prevention is risky in prevention of cardiovascular disease and do plenty of harm.
Studies have consistently shown that cholesterol-lowering statins actually increase the amount of calcified plaque in the arteries. Ironic for a drug that's supposed to prevent heart disease. The Veterans Affairs Diabetes trial found that more frequent statin use was associated with accelerated coronary artery calcification. Another study published in the journal Atherosclerosis found that statins also increase the amount of calcified plaque in healthy people without diabetes. And yet another study published in the Journal of the American College of Cardiology found similar results. These studies have been quietly ignored by the medical establishment and the mainstream media.
Moreover, what we have discovered that statin increases risk of new onset diabetes releases by fourfold and is irreversible and render current diabetes melts uncontrollable with no protective effect of statin, as they've been told that it could protect you from having diabetes. It's the lie of the century. It inhibits vitamin K2 and leads to increased onset of cardiovascular diseases, chronic kidney disease, heart failure, cerebral bleeds, and bone fracture. Erectile dysfunction is 10 times more in young men when taking statins, and when you stop it, over 50% had recovered.
I honestly don't believe that doctors do recognize statin side effects, even when they're sitting right in front of them. In the middle of my 2-year illness, I saw my internist for our annual check. After briefly noting that I was seeing several specialists for my dry eye problem, my arrhythmia problem, my colitis problem, and my depression, she then got to the heart of the visit, which was that she was delighted that my cholesterol levels were under control. I find it ironic that neither she nor I ever stopped to question why a relatively young, healthy person had suddenly developed 5 new illnesses in 1 year. And the only new thing in my life was Lipitor.
There is no scientific evidence for use of statin in primary prevention or any patient of the age of 60, mainly in women. In Queen English, the lower your cholesterol, the shorter you will live. Moreover, pre-op statin therapy, when you give the 8 mg of Lipitor, increased risk of cardiac surgery-associated acute kidney injury, rhabdomyolysis, by 4-fold higher as a result of statin.
Australia's National Heart Foundation is examining new American guidelines for cholesterol-lowering medication.
The new guidelines greatly expand the number of Americans that would be eligible to receive statin drugs from about 36 million previously to as many as 72 million now.
Paul Ricker and Nancy Cook of Brigham and Women's Hospital looked at published studies of patients with cardiovascular disease and say the new calculator significantly overestimates the risk. The calculator may suggest statin treatment for about twice as many middle-aged Americans as actually may significantly benefit from it.
One of the recent articles in the New York Times showed that 12 out of the 15 panel group are affiliated with the industry.
The drug industry buys influential doctors. And these doctors are allowed to sit in guideline committees?
So FDA linked epidemic of conscious decline, dementia, amyotrophic lateral sclerosis, and motor neuron disease to all types of statin. It confirmed a 10,000-fold increase in amyotrophic lateral sclerosis with statin use. Familial hypercholesterolemia individuals exhibit insulin-resistant phenotype and hypercaloric risk and better being done by new drugs. Elderly people with high LDL live longer. Moreover, patients with acute MI have lower than normal total cholesterol. Genetic studies have shown that the loss of PCQ9 gene is associated with an increased risk of diabetes, added to a lot of sudden deaths with higher rate of cancer. Mr. Chairman, ladies and gentlemen, lipid hypothesis created the war on fat and cholesterol, which commanded 65 years